Hi, I'm Dr. Jim Carlson from the Grove Animal Hospital and Holistic Center, and this morning we're going to be discussing case number 00351. This is a 9-year-old canine, a Rottweiler, and the current symptoms were lumps forming, and then also we had some greenish eye discharge. And we didn't do any current treatment, but past treatment she'd been on the IHT program, so it's a retest for these current symptoms here. And if we look at the presentation, genetically we present lumps and eye discharge. Well, what does that mean? So the analysis looks, if we have red or weakness, it's usually less than 47. That's called a chronic phase to the symptoms, and we didn't have any, so that was negative. The acute phase is anything greater than 55, and we had 3. So the ones specifically related, the sinus drainage is represented by LY3 circuit, so green discharge. TW3 is the sensory circuit for the pituitary and pineal, so information coming into as far as smell, taste, touch, hearing, those things are going to be first of all processed by the sensory circuit. So if that's stress, then it's usually sending off a stress message into the body, and it can contribute to digestive issues or body changes, things like that. It's also age related. 9 years old, usually dogs that are over 5 will experience some level of hormone change, and so we want to make sure that we rebalance that. And then finally, stomach was stressed, and that's for pre-absorption. The stomach stress, because the food goes into the stomach for pre-digestion or pre-absorption, is that the food has to sit in there a certain period of time in order to be properly broken down for the next phase of digestion. So if we're a little stressed, we may not completely get that taken care of. So then we can get issues in the system as far as absorption of nutrients that may contribute to the other inflammatory issues. And lumps, because lumps are usually the body's way of detoxing. So if we have toxin X here, and the liver and kidney are not sure how to dispose of that, we've got 3 options. One is connective tissue, or skin, or even into the joints to be deactivated. So what she did is she chose skin and decided to make a lump with this toxin in it. And it's been deactivated, so it's no longer viable or dangerous. But if she's doing that more often, then by correcting these, we're going to put her in a better position to either reabsorb this correctly or just leave it. Because if she reabsorbs the lipoma or lumps on the body, then it's going to be a deactivated toxin, so it's not harmful. It just gets cleared through the urine or feces. Okay. So how do we take care of this? Well, the hemp oil infusion for stomach, sinus, and sensory, we get this corrected over 3 months. And then I like AC Carbamide. It's from Standard Process. It helps a lot with these 2 things right here, especially. It's amino acids, and it does a nice job to balance the nutrition, and it also helps with pre-absorption as well. So those 2 things for 3 months, and then we can follow up after the therapy to see what our condition is, how we're doing. Because overall, the idea for BioScan is to keep the body in condition. Before it presents us with genetic expressions, we want to be aware of it at the molecular level. Unlike a blood test that compares other dogs to the patient, in this case we're looking at the individual and determining why do they have these things versus what they're doing. We know what it is, lumps. We know where it is on the body, but this tells us why. Same way with eye discharge, so it's important. If you have questions, 847-541-4005 is our direct line for call to have questions answered, or use our email, growpets@yahoo.com. Thanks so much.